Hi there, this is Dr. Jack Bielitz, and welcome to another edition of the Ask Dr. Jack Show, where we answer the questions that you ask. I want to get this out of the way at the very beginning because it kind of applies today. We are not here trying to give medical advice. All we're trying to do is give you great information that we get from research that you could very easily find on the internet yourself, make it easily available to you so that you can use it to make decisions that are best for you and your family. So that especially applies today because our topic today is on SSRIs or antidepressants. And the title of it is Antidepressants, Bad for the Bone. I know, kind of like that myself. Anyway, antidepressants are some of the most commonly prescribed drugs out there. And a huge part of our population is taking them on a regular basis. And basically, what we're finding out is, we already know there's a bunch of really negative things that these things do over time, but we just got some more really bad news, and that is that they are incredibly bad for your bones. New research has shown that they contribute a great deal to osteoporosis type condition as you age. Now, a lot of people want to know, how can this possibly be? Well, what we have found is, let's start from the idea that there are two types of cells that are important in strengthening your bone. You've got your osteoblasts and your osteoclasts. The osteoclasts are there, and what they do is they tear down the bone. And then the osteoblasts go in and take the bone and rebuild it. And with this continual tearing down and rebuilding, it makes your bones stronger and stronger and stronger. And so they're both a very important part of that process. Now, what research has recently revealed is that both of these, the osteoclasts and the osteoblasts, have receptors for serotonin on their cell walls, which basically means that the amount of serotonin in the body affects how these cells work and how well they work. SSRIs work, or antidepressants work, because they work with serotonin, which is kind of a neurotransmitter in the brain. And one of its functions is on how well you feel, if you feel depressed or happy or whatever. And it's a great deal. And so what these SSRIs do is they control how much of this serotonin that is available in your brain. But by doing so, it also controls or has an effect on the amount of serotonin available for the rest of the body. And so because of this, we are finding that these osteoclasts, or that serotonin, interferes not only with the function of these two types of cells, but they are also causing them to start dying. It's a process called apoptosis, and it's basically just a death of these osteoblasts and osteoclasts over time. So 19 studies were reviewed, and the outcome of this review of all these studies is showing that SSRIs have a negative effect to the bone, particularly with regard to bone mineral density and fracture risk. So pretty darn huge. I mean, this isn't just one study. This is a review of 19 different studies that came to this conclusion. So this is by no means just a single study off by itself and maybe not hold some weight. This is some pretty significant research that's gone onto this. So it's pretty clear that if you want to live a long and happy life, you've got to get off or don't ever use these SSRIs. Now, the good thing about it is there's a lot of great ways to treat depression without having to go to these drugs. Now, one of the reasons that we're doing this topic this week is because a very wonderful patient of ours is considering this, and so of course we do research on this, and so we found all this information out. But the argument is, well, how easy is it just to take one pill once a day? You know, could be easier, and then that kind of solves the whole problem. Well, you know, it doesn't solve the fact that your body starts being unable to produce its own serotonin, which now makes you addicted to these drugs. It doesn't stop the fact that there are other major side effects, including drowsiness, a flat emotional response, which basically means that, yeah, you don't get depressed about stuff, but you also don't get excited about stuff to the same extent, which means that you lose some of your personality. And if you're a parent, you know, your kids are expecting that joy to come over your face when they do something great, and when it's not there to the extent that they're used to, it's got to affect these kids. Also, suicidal tendencies are greatly increased in people that take these drugs, as is aggressive behavior, sexual dysfunction, dry mouth, headaches, and there's a ton more. And now we can add to it brittle bones. So, please, if you are taking SSRIs now, or if you are considering taking an SSRI because maybe one of your friends is doing the same, please give us a call, 402-333-4848. We can talk about the different alternatives. Yes, it's a little more intensive than just taking one little pill once a day. I will give you that one. But in the long run, how much better is your body going to be if you can manage to stay off of these drugs? Anyway, that's it for this episode of the Ask Dr. Jack Show. If you have a question you would like us to research, please give us a call, 402-333-4848. You can use that to also get a consultation if this particular subject is important to you, because we do a good job of working with people on this type of problem. You can email us at askdrjackb, that's B-E-E, @gmail.com, or please just stop in and see us and give us the question in person. I hope you have a really awesome, happy, and healthy day, and I just can't wait till the next episode of the Ask Dr. Jack Show, where we can see you again. Have a great day.